was one of the first infection control nurses in the country. And we had to figure out how to do prevention of infections in hospitals. And it took a while to do it, and we went through different phases, but some things never change as far as how viruses and bacteria are transmitted. So I think right now with this coronavirus, first of all, we're going to call the coronavirus SARS-2. The other name is SARS-CoV-2, but we're just going to shorten it for our purposes to SARS-2 instead of COVID. And SARS means serious respiratory infection. And that gives you an idea of how this virus is spread. It's a cousin of the SARS-1 that we had a few years ago. So we've learned some things from that, but this virus is very different in a number of different ways. So everybody in the world seems to be afraid of this virus. The virus knows no borders. It knows no country borders. It knows no neighbor borders. It knows no sick and healthy and well and rich and poor. The virus knows no borders. And it seems like people all over the world are afraid of this virus. So my purpose today is to make you into warriors about this virus. And you all know the term knowledge is power. I'm going to teach you about this virus, and
the Zoom one, but the Facebook one,
you will at the end feel like you understand and you're not afraid. You're going to be using what's called your mind's eye. So when you think about your mind's eye, think about your mind with an eye in the middle of it, seeing everything. Your mind's eye. I have no visuals for this, so I'm going to just have to talk to you about things. And I'm going to tell you first some scientific facts about the virus. So I want you to think like a scientist, think like you're an epidemiologist, think like you're an infection prevention person in your mind's eye. So this virus is, as you know, a coronavirus. Corona means crown. And if you've seen these pictures of it, it looks like a crown all around the virus. The pictures that you see are electron microscope pictures. It's not like you can go into a high school biology lab and look in the microscope and adjust it and then you see the virus. These pictures that you see of the virus are from the electron microscope. So you'll Google this later and see a picture of the electron microscope. Those little protrusions on the virus, those little things sticking out that look like trumpets, they have a particular type of protein on certain ones of them. And the protein has an attraction to certain receptors in your body. So it's like in plumbing, the male and female ends of pipes. The proteins have places where they can hook on in the human body and start their work in the human body. The receptors, they have a name, but we won't worry about that. The receptors are, guess where? In the lungs. Of course they're in the lungs because it's a serious respiratory virus. They are also in the gastrointestinal tract, meaning the stomach and the colon. They're there too. But the primary symptoms are in the lungs. This was first, as usual, found in bats. Why in the world have so many of these diseases that have afflicted us, like Ebola, SARS, why do bats carry them? Don't ask me that. I'm not an expert on animals. But I know that they came from bats. And then oftentimes they came from bats to monkeys. Some type of monkey is in between us and the bats. Those are called zoonoses, Z-O-O-N-O-S-E-S, zoonoses. That's a type of infection that goes from an animal to a person. So that's where they came from. It started in what they call wet markets in China. meaning that they slaughter animals right there in the market. So there's a lot of blood and guts and who knows what else in the markets. I listened to Jane Goodall today. It's worth going. She has something on Facebook. It's really great about animals and the virus and her and the virus. Jane, Goodall, the person who worked with the apes. And so she's got something, and she says that China has issued a nationwide ban on killing wild animals and selling them for meat in their marketplaces. China has actually issued that ban. So I just found that out today. You find out new things every day about this because there's so much being done. The other thing I'd like to do is say a thanks to the Chinese doctors and scientists that have provided us with the information from their outbreak. They have done these studies and passed them on to us so that they can help us figure out what we need to do. And the other thing you should know about is that doctors and scientists who focus on emerging infections, have a network now that they set up where they share information all over the world. It used to be that they wanted to be the first ones to sequence the virus or the first one to find a vaccine, and everybody was in competition. That's no longer true. Scientists and doctors everywhere, think of all the universities, think of every place, think of the National Health Service. Think of the National Institutes of Health. Think of the Centers for Disease Control and Prevention. Then think outside our country. Think in England, think in Israel, think in Germany, think in Italy, think in Spain, and think in China. So all of these scientists are at work right now trying to find a treatment and trying to find the best way to help people. So how is this virus spread? The main method of spread is airborne, through the air, airborne. In droplets, usually. Little microscopic droplets, or sometimes you can see when you cough or sneeze and the sun is shining, you can see something coming out of your mouth. So it's spread through the air. So the reservoir for this virus is human lungs. Now the problem is, why is it spreading so fast? Why is it so contagious? The problem is people can be testing positive. If you swab their nose, if you swab their mouth, comes out positive for the virus, but they have no symptoms whatsoever. In fact, most people aren't even going to have any idea that they have it. So we have no idea who has it. So you do what we do in infection control. We assume everyone has it. Now, this is going to be different depending on your community, on your state, and on what's going on. But for purposes of stopping this infection, we must assume everyone has it. Even if it's not in our community shown, it could be in our community and no one knows about it. There is something called community spread. Community spread means that someone is infected, tests positive for this SARS-CoV-2 virus, and they have not had contact with anyone who is known to be positive. And they have not traveled anywhere to any part of any country where there are known positive infections. That is called community spread. And most of us in the United States, in our states, have community spread. And then our governors, as soon as that is seen, they impose stronger restrictions on what they want us to do. So now the restrictions in this country, everywhere, are that we stay inside our homes and that we go out when we need medical care, but we call first to schedule it. We go out if we need groceries, but most of us have stocked up on groceries and we can eat soup for a long time. And those are the main things: the pharmacy, the grocery store, and the hospital or the doctor's office. But otherwise, you stay home. The other method of spread is what's called the fecal oral transmission. The mode of transmission is called fecal, that's feces, that's poop, oral, O-R-A-L, fecal oral transmission. That means the virus is shed in stool, human stool. So anytime we might have contact with stool, we need to be wearing gloves. And they don't need to be special latex gloves. They can be the same rubber gloves you use to scrub the floor. But the fecal oral route of transmission is not the main route. The main route is oral. So we're going to keep focusing on what the main things are. I'll say one other thing, which is vertical transmission. Vertical transmission means pregnant mothers being able to give this infection to their child, their unborn child, and the child is born with the infection. And at first, when I prepared this talk at the beginning of the week, it said known cases of vertical transmission. Today, what do I read? An article about vertical transmission. I don't know that that's been confirmed, but each day there's more information and each day it gets scarier, but I'm not going to let us be afraid, because we know how to protect ourselves and our families and our loved ones. We know what we need to do. We know the main reservoir of this virus is in human lungs. It's not in your mail. It's not on your counters. I'll talk about that more later on. Okay, so, and the other thing is fomite transmission, F-O-M-I-T-E, transmission by fomites. Fomites means your countertop. It means your chair. It means your dishes. It means anything that is not human or animal. Which reminds me, side note, I just read today that we should avoid our animals if we're positive for this virus. They don't know yet what happens in animals, just like regular dogs and cats. So they say if you're someone who is sick and tests positive for the virus, you shouldn't take care of your animals. That's what the Center for Disease Control has said. If you're sick, you should not take care of your animals. Okay, so how do you know if you have it? Oftentimes, you don't know, but the main symptom at the beginning is a cough. It is not a fever. The main symptom is a cough, a dry cough, meaning you don't spit out sputum when you have the cough. That's a dry cough. That's the main symptom. Fever happens in maybe a quarter of people, but as the infection continues, if they have symptoms, then the fever develops. So it ends up being cough and fever. And it also may end up being hard to breathe. So we'll talk more about that at a later time. In the average course, if you're sick, if you test positive, there's something called viral load, L-O-A-D, load of the virus. There is the same viral load in people without symptoms or people with symptoms. Now that should give you an enlightening message about why this virus is so easy to spread. The same viral load if you have symptoms, so you would test positive if you had the swab done, you would be positive. You would be positive, and you would have the same number of viruses in your saliva, in your sputum, in your lungs as someone who has the symptoms. The viral load lessens as the disease course continues. Most people recover at home. Most people who have SARS-CoV recover at home. About 20% of people end up needing care at the hospital, needing oxygen, needing support at the hospital. Only about 5% of that 20% end up in the intensive care unit. And maybe 1%, that depends on where you are, but maybe 1 or 2 of those 5% end up needing to be on a ventilator or respirator, hooked up to a machine to be able to help them breathe at all. So now the average course of this illness is 8 days. It can be 6 days, it can be 14 days, but the average, that's what we're going to be talking about, the average is 8 days. But you can stay contagious after you recover. And there are varying reports of how long you can stay contagious. For an average of 8 days after your symptoms resolve. It may very well be up to 14 days, which is not unusual. A few people are contagious up to 25 days after they recover. So, who is more susceptible to this disease? They've changed the definition of old people. It's not over 60 anymore. It's over 80 now. Aren't we happy? Aren't we who are in our 70s? We're so happy we're not old anymore. So people over 80 are more susceptible. Anybody with underlying conditions, we call it, I'm teaching you this sort of medical language. So you're going to talk and think like a doctor, like an epidemiologist, like a scientist at the end of this time together. Okay, so it's comorbidities. Comorbidities. People with comorbidities, such as diabetes, anybody who is immunocompromised. Compromise means it doesn't work. It doesn't work how it's supposed to. It's less, it's lower. They have decreased immunity, lower immunity, immunocompromised. Diabetes will do that. Parkinson's will do that. Radiation therapy will do that. All kinds of things, and you all know, if you have them, that you're immunocompromised. But the thing I have not heard anybody talk about is alcohol. Alcohol suppresses your immunity. You can have a night of binge drinking, and that in and of itself will suppress your immunity. Nobody's talking about that. Lots of people are using alcohol to help them stay calm. And it suppresses your immunity. So now you know that. It may be time for people that have an issue with alcohol. What I always ask people is, if you know it's not in your best interest to have another drink and you have one, that means you have a problem with alcohol. That means alcohol is controlling you and you're not controlling it. So this may be a good time for people who have that problem to protect themselves. What about children? Children in general tend to get a milder form of the illness, with the exception of babies less than 1 year old. They can be more susceptible to a more severe form of illness. But children in general have a mild form, but guess what? They've got it in their saliva, they've got it in their nose, they've got it in their lungs. If they test positive, they have a milder case of it, but remember, they have the same ability to infect people as people with symptoms. In China, they had a 14-year-old boy die of the infection. So it's not like children don't get it, it's not like children don't die. Young people. There seems to be an issue with young people in the United States, especially the ones who are on spring break from college, who think that they're invincible. They're not invincible. And they're also carriers. If they test positive for this virus, they are infecting the people that we're trying to protect. They are infecting the people that are more susceptible, that are immunocompromised, that have these various diseases. Young people need to be part of the team. We need to convince them that they need to be also part of this team of warriors to help stop this virus. So anybody you know who's a young person, please talk to them about it. Tell them about it. Tell them about how they can have this virus in their saliva, in their lungs, and not know it, and breathe it out, and cough it out, and sneeze it out, and infect people around them. I think it's really great that people that are old, this time they say 60 and over, can go to the store early in the morning, like from 6 to 9 o'clock. Go to Dollar General, can go to Safeway, can go to Lowe's. They can go shop when it's only older people and not a lot of people and not younger people. So if you're old, this time not really old, over 60, but you want to go to the store when it's those hours for old people. And I think it's great that in our country, we're finally honoring old people. You know, in Asia, old people are always honored. They're always the most important people. Guess what? They're the most important people to be protected from this virus in our country. Amen to that. Okay, so if you are sheltering in place, that's the other word, sheltering in place. If you're doing social distancing, that's the other term for it, social distancing, sheltering in place, hunkering down, you should eat healthy as you can. For me, this is a hard thing to do because I hate vegetables. But try to put a vegetable in your diet whenever you can. If you can put a live vegetable, that's wonderful. If you can put a canned vegetable, that's wonderful. If you can put only a dried vegetable, put the dried vegetable in there. Eat more vegetables. Move more. So eat vegetables. Eat a healthy diet. Take a multivitamin. People always ask me, should I take a multivitamin? And the answer is, from the nutritionist, if you have a good diet, a healthy, balanced diet, you don't need a multivitamin, because the vitamins that are in the multivitamin, your vitamin receptors are already full from what you're eating. And so it just goes out in your urine. But in this day and age, I think we feel better if we had a multivitamin. Sleep more. This is really important. It's important how sleep can energize you, how sleep can restore you. That's why everybody is designed to sleep more like 7 to 9 hours rather than 5 to 6 hours. My friend Paul, the epidemiologist, psychiatrist, might be sleeping 6 hours. But sleep more is really important to protect your health. And remember, assume everyone has it, everyone. So I'm going to tell you how to calculate the mortality rate. The other words are the fatality rate, fatal fatality rate, the mortality rate, the death rate. There's a simple way that everybody can figure out what's happening in their community. And I've taught my daughter Jillian, I need to acknowledge my co-hosts. This is a sidestep now. My co-hosts are 2 millennials. The one millennial is right here. You can't see him, but he's Dr. Brandon Whittington, who is my sacred physical therapist, who has helped me. I had a back surgery in December of 2018, and I ended up not being able to walk. He has helped me learn to walk. And he works with me as a team. We figure out different ways of doing it. We figure out things I'm doing that are making me fall, and we figure it out. So for those of you that are local in Calabash, he and his wife own a clinic called Level Up Physical Therapy. And if you have problems, go to Level Up, and they will figure out on an individual basis the cost benefit of doing the physical therapy, whether it's worth it for you to do the physical therapy and what your risk is. They have full schedules of patients when I went yesterday, because they have created an environment of protection and safety, and the patients know that their safety comes first before whatever else you want to say. Anyway, that's Brandon, Dr. Whittington. And the other one is my wonderful daughter, who does not want me to acknowledge her, Jillian Nicely. Many of you know Jillian. She has been the central figure in helping me, and she's not even here at the house. She's in her house an hour away in Wilmington, North Carolina. She has helped me figure out all this technology. I think anybody 60 and over is afraid to press buttons. So that's the problem. You're afraid if you press a button, everything's going to go away. Remember when you used to type in Word, if you didn't save it, everything went away. So we're afraid to press buttons. These young people like to press buttons. My daughter pressed buttons on our relative's computer, Mary, and when she was 2 years old, because we didn't have one. She's not afraid to press buttons. At any rate, I have to stop talking about this, but I do appreciate Jillian's help and Brandon's help tremendously. If it weren't for them, none of this would be happening. Okay, so back to the mortality rate. You take, when you hear this or you read this, you take the number of deaths and divide it by the number of confirmed cases. It's best to use confirmed cases, meaning people who've had the test and it's confirmed that they have the infection. And so you divide the number of deaths, the smaller number, by the bigger number, the confirmed cases. And then you have to move the decimal point when you divide this bigger number, bigger number into the smaller number, move the decimal point 2 places to the right, and it gives you a percentage. That is your death rate in a percentage. Now, we've watched our death rate here in North Carolina go from 1.2 every day. It's a little bit more, 1.3, 1.4, and this means 1.4 people out of 100 are dying from this. But you have to think beyond your community, beyond your state, beyond your country, into how many people are dying from this. So you can keep track of your mortality rate. The mortality rate in Italy and Spain is 7 out of 100 dying. That's massive. Massive numbers of people need ventilators. Massive numbers of people are dying. So the next thing I'd like to do is a form of meditation. You should feel empowered now that you know what this virus is like, how it's spread, what the human reservoir is, and how to make sure that you're 3 feet away or 6 feet away. When you cough or sneeze, it goes 3 feet. Some people say stay 6 feet away. Other people like you are sheltering in place. Next week, we will talk about, at the same time, we will talk about treatment. Why don't we give everybody hydrochloroquine? It's cheap, it's used to treat malaria. Why don't we just give everybody hydrochloroquine? There are doctors in our country, I'm sure everywhere, that are hoarding hydrochloroquine. Right, Paul? Hoarding hydrochloroquine. Yep. And so why don't we just pass it out to everybody? It's cheap. Well, I'll tell you next week why we don't do that. And I'll tell you next week about what's being done trying to find a treatment. I'll also tell you next week where people are from who are on this call. And I'm also going to give you an assignment. In addition to this meditation, I'm going to give you an assignment to try and think of what you can do to distract people at home. What things you can do. What things have you done? Have you started a garden? Have you adopted a pet? Have you cleaned out your cupboard? They say in Health Coach International, where I've learned for the last year and a half how to be a health coach, which is different than being a doctor. But they say clean up the clutter. How you do one thing is how you do everything. If you have a cluttered pantry, like me, your brain is cluttered also. If you have a clean and neat and organized pantry, your brain tends to be more organized. So that's one thing you can do. But think about what you can do. And send me a message. I don't know about this chat thing, if it's on
I have
yet.
a question right here for you if you want.
Oh,
If you want it later, you can have it later.
yeah, we'll have questions at the end. But I'm going to collect all the questions. Jillian is going to be taking screenshots of questions. You can type them in as we go. Type in the questions. And Brandon is going to be taking the Zoom questions. And we'll look at all those later. And next week, we'll answer the questions if we don't have time today. So what I'm going to do now is this meditation. Oh, I want to say one other thing. Next week, we'll have the mask pattern. My Aunt Jeanette has beautiful masks, which she'll model for you. We'll have her picture on there next week. I also need to tell you, and someone in my community also has a pattern for masks. I want you to know that the Center for Disease Control says that disinfectants, household disinfectants, which are FDA approved, are effective. Household disinfectants. If you have somebody at your house who actually has this, Clorox is the main thing that kills everything. Good old Clorox. The other word is sodium hypochlorite. It kills everything. So make sure you have some Clorox on hand. Okay. Meditation. This week, I heard someone really important talk about emotions. His name, and some of you may know it, is Deepak Chopra, D-E-E-P-A-K. If I had a visual, I would write that down. If you can write it down, put D-E-E-P-A-K, Chopra, C-H-O-P-R-A. He's an Indian physician. When I learned transcendental meditation, when I was 23 years old, I heard him talk about all of this. And he was on a YouTube video this week talking about how emotions can conquer this virus. So go on YouTube later on and look for Deepak Chopra from this week and listen to what he has to say. And I guarantee you it will help calm your fears. So he's saying our emotions are contagious. They know no boundaries. Think about when you watch Psycho, Alfred Hitchcock, and the knife in the shower. Think of how scared you were. Think of how scared you were on Halloween, just on Halloween, because everyone else is scared and you kind of want to be scared. And it's contagious. One person is scared, the next person is scared. You're all scared. So Deepak Chopra, since he's a physician, talks about the various hormones in your body that are secreted or called up, we say, various hormones are called up, when different emotions are exhibited by you. So adrenaline or epinephrine is the fear emotion. Fear, and it makes your heart beat faster, it makes your blood pressure go up, it makes you ready for fight or flight, adrenaline, epinephrine. But we have other emotions too that can combat the adrenaline. So the emotions that can combat the adrenaline are love, peace, joy. This is a big one, compassion for others. You're going to be warriors in this war against the virus. And you're going to use compassion for your fellow man. I have to say at this point that I'm a Christian, but I don't want the fact that I'm a Christian to be exclusive of people who are not. I'm going to ask you in this meditation, there are going to be 3 parts of it. I just have to say one more word about I'm a Christian. I've been a nurse and a doctor for 50 years now. I've never healed one single person. I only heal people through God. God is who heals, or Allah. God heals, not doctors. We have God's help.
Yeah.
I've delivered hundreds of babies. I see them. God is sitting on my shoulder as I'm delivering those babies and touching those humans for the first time. God is there. So I want you to think about how you can view what can help you. So when we do this meditation, the first thing is we're going to take 3 deep breaths, and we breathe in longer than we breathe out. So we might breathe into the count of 6 and out to the count of 3. So the first thing we'll do when we're doing this is take 3 deep breaths.
Good question, answer.
The next thing we're going to do is a guided imagery. Many of you have done this before, and I'm going to be your guided imagery person. This is going to help you relax your body, okay? So I'm going to take you on guided imagery, and your job right now is to think of a special place that you go to where you've been before, and maybe you've just been there in your mind's eye, where you feel at peace. Think of where you can go that you feel at peace. The next thing in this meditation is to meditate using a mantra, M-A-N-T-R-A, mantra. When you're doing special types of meditation, ancient meditation, there are Sanskrit words, S-A-N-S-K-R-I-T, Sanskrit words that are given to you to be your mantra. So I was given my mantra when I was 25, and I've never told it to a single person yet. But we can meditate on other things. You say meditate on. Meditate, it's meditate using, but you say meditate on. We're going to meditate on love today. And so you're going to repeat in your mind. Your eyes will be closed. You're going to be hopefully where you're not interrupted. If you have children, they can run in and out. If you think of other thoughts when you're meditating, let those thoughts come in and out. Don't try to keep them from coming in. You just let them come in and slowly also let them come out. So we're going to do this meditation for only somewhere around 5 to 7 minutes today. But we're going to do it so that you get a sense of how it works and how you feel. When you start to meditate for the first time, you will not be able to stay calm and stay focused for very long, maybe 5 minutes to start. But you'll find as you do it, and you're going to be doing this twice a day. You're going to be doing this twice a day for at least 3 days so that you can see what happens when you do it. You'll put it on your calendar. You'll put it on your phone. You'll put it on a piece of paper. And you'll check it off every time you do it for 3 days, morning and evening. You decide the time. You decide how to keep track of it. But you're going to do it, try it for 3 days, morning and evening. Next week, you're going to tell me how that worked. So that's the meditation part. And the last thing is ask for help. This is where you ask your higher power, whatever that is, for help in fighting this virus, in keeping you safe, in keeping your family safe, in keeping your community safe, keeping your country safe, keeping other people, refugees. You've seen them. Several people sharing 1 bucket of water if they have that. Some people have none. We see these horrible pictures of people that are our brothers and sisters. The Bible says, love your neighbor as yourself. And I'm sure the same thing is in the Quran and the same thing is in Judaism. Love your neighbor the same way you love yourself. So this is your chance now. This virus is giving you a chance to show that you love your neighbors with your compassion, with your love. It comes out from you. You can see it in your eyes. I can see it in the people that are on my screen right now. I can see it in your eyes. I can see it in your body language, your posture. I can see it in your face. And so those emotions that you're experiencing now are going to be contagious. You're shedding those emotions. They go everywhere. They know no bounds. So the last thing you'll do is ask for help from your higher power. Some people do not have a higher power. They are truly atheists. But even if you're an atheist, maybe for the purpose of this exercise right now, you could just pretend to do this meditation and pretend there is something that is above you or around you that might be able to help you. And then the last thing we're going to do, those of you who know the Bible, I just keep thinking of this. Gird your loins. Gird your loins. Now, we're going to put our armor, emotions, our compassion, our love, our joy, and we're going to be girding our loins with these things, and we're going to be going out in the world, the virtual world. The virtual world is incredible now. Just doing this, that I can talk to all of you. The virtual world. We'll be able to gird our loins. I bet you most of you have never girded your loins before. So that's going to be the last thing we do. So now we're ready to do the meditation. So the first thing is, take 3 deep breaths. Close your eyes. Shut out noise. Take 3 deep breaths. I'm taking them with you. Now you've taken 3 deep breaths. The next thing is going to be guided imagery. I'm going to help you relax your body, starting at your toes. Feel your toes. Wiggle your toes. Let your toes relax. Feel your feet. Flex your ankles. Allow your feet to relax now. They don't need to be carrying you around right now. Feel your lower legs and your calves. Let them relax. They don't need to be holding you up right now. They need to be allowing you to simply focus on your mind's eye and relax your body. Relax your thighs. So now your whole legs are relaxed. Relax your abdomen. I'm allowing you time to think about this because it doesn't happen instantly. You have to use your mind's eye and relax your abdomen. Relax your back, your lower back, your upper back. Relax your shoulders. Now relax your arms. Relax your upper arms, your deltoid muscles. Relax your lower arms below your elbow. Now relax your hands. Relax your fingers. Now relax your neck. Relax your face. Allow your face to just be neutral, not showing any expression, just neutral, because now you're in your mind's eye in your beautiful place that you go to when you want to relax. Now you're there. Now that we're relaxed, we're going to meditate using the mantra love. You keep your eyes closed, and slowly in your mind's eye, you're going to say the word love over and over and over again. And we're going to do this. I'm going to time it. We're going to do this 6 minutes. So now the time is up, and we'll take 3 deep breaths like we did at the beginning. Longer in, shorter out. 3 deep breaths. And open your eyes at the end. Okay, everybody. Did you feel the power of that? Could you feel the power of everyone who is on this call meditating on the word love at the same time? Can you feel the contagion of your compassion it's just, I think it's just miraculous that our compassion and our love for each other and for our fellow man can be expressed in this way and multiplied exponentially. Like that virus, it's multiplying exponentially, but guess what? We're warriors now, and it's time to gird up our loins. And we will go out or stay inside and go out virtually and be prepared to fight this virus, because now we know how to think like scientists. We know how to think like doctors. We know how to think like infection control practitioners. We know how to think like church people. We know how to ask our higher power for help. And we know the power of doing that together every time we do that together. So we will be doing that together this week, because there are so many people doing it that we will be doing it together in all different time zones. And you will feel the help from others, meditating on the word love at the same time. And you will all be warriors in this fight to be in control of the virus, not have the virus be in control of you, not have the virus give you fear, not have the virus give you panic. You will control the virus. So I want to take a minute to thank all the healthcare workers. You've seen all these signs in the media. I went to work so you could stay home. It almost makes you cry. I went to work so you could stay home. So you will be doing your part by staying home and by helping others. And all those healthcare workers, not just doctors and nurses, but respiratory therapists, housekeepers, lab techs, all those workers will be taking your place so that you can stay home and stay safe. I'm going to answer a couple questions with the few minutes that we have, but I want to say that I'm going to schedule a meeting like this. We'll see if this worked on Facebook. Do you think it worked on Facebook?
Yeah, everybody's here. You got
Great.
comments coming in. We have
Great.
questions coming in.
So this is the first time I know of that somebody's doing Facebook and Zoom at the same time. We will schedule a similar meeting next week, because now we're in this war together. We are our own battalion. We will schedule a meeting next week at the same time for the same amount of time, and we will, number one, say where we're all from, who we are working together. Number two, answer questions that haven't been answered this week. Number three, we will talk about treatment. We will talk about why don't we give everybody hydroxychloroquine, the malaria. Pretend everybody has malaria and give them hydroxychloroquine. No, we will find out next week why that's not really a good idea. And you will be more empowered by knowing more about the science, by knowing more about how studies are conducted to determine how to help this virus. I used to be a certified principal investigator in phase 1, meaning early phase, giving drugs to patients for the first time. And next week I'll talk to you about, and we'll answer questions. And you remember, your two things for this week are, one, think of things you can do to help each other for next week. Number two, meditate twice a day, morning and evening. The whole thing should take 20 to 30 minutes for 3 days. And if you think it's helping you, continue to do it. Meditate twice a day, and you'll keep doing that. And you'll come back here next week at the same time. I'm going to, this session has been recorded, and I'm going to put the recording on my Facebook page, on my email, the same way that I got in touch with you today. I'm going to put this video recording so you can have people that haven't been able to hear it today able to hear it. You're able to do forward and transfer the recording. The only thing that doesn't happen, I know, on this Zoom is the chat does not record. But I'll be making sure that all the questions in the chat, Brandon's making sure he's got those. So let's take a couple questions.
Okay, do you want them from Zoom or Facebook first?
I'll try Zoom first and then we'll go to Facebook. I heard Advil is bad, only take Tylenol. This is my cousin Heidi. Advil is always, the problem with much of what's happening with this virus and also with most of our other diseases, chronic diseases, the problem is inflammation. There is a book you can get from Amazon. It's called Undo It, U-N-D-O, it. And it's written by the person I talk about all the time. His name I'm not thinking of right now, but it's Undo It on Amazon. It talks about how we can get rid of inflammation and how then by getting rid of inflammation, we can control other crises. So Advil is an anti-inflammatory pill. So Advil is not bad. The trouble with Advil is if you take a whole bunch of it and you're not paying attention and your stomach starts to hurt, it can create a hole in your stomach and cause bleeding. But you have to take a whole lot of Advil to be able to do that. So take Advil, take Tylenol when you have a headache, take Tylenol when you have a fever. Advil, though, is also a very good, it's a more potent anti-inflammatory agent than is Tylenol. The next one is my niece, the brilliant Laura. She reads everything. She's in New Hampshire. I read ACE inhibitors might be bad, but only discontinue if you get sick. Anything new about that? Okay, ACE inhibitors are used mainly to treat high blood pressure. If you're on one, you'll know it's an ACE inhibitor. You would not be wise to discontinue any of your medications that you take that are prescribed for you, that are helping you, to discontinue them at this time. If you're on an ACE inhibitor, do not discontinue it unless you talk to your doctor first. Good luck trying to get hold of your doctor. But ACE inhibitors, if you're on them, you should stay on them. The other thing she says is, I would also like to hear your thoughts about how wave occurs in epidemics. I'm going to save that question for next week. Epidemics go up and down. That's why everybody in China is wondering if now that this curve, this up and down curve, is flat, is it going to go back up again now? We'll talk about next week. But we should say something about flattening the curve of epidemics. If you think about everybody gets sick at the same time, and now you pretend to have up and down. Everybody gets sick at the same time. Everybody needs a respirator. We don't have enough respirators. That's bad. So what we're trying to do by isolating in place, by social distancing, and by fanning out our emotions, our good emotions to everyone, we're trying to make that curve so that everybody doesn't get sick at the same time. We're trying to prevent it from happening. So if you think of the curve now, you think of it this way. And so in our country, we're all trying to flatten the curve so that they have enough masks, so that they have enough ventilators, so that everybody doesn't get sick at the same time. Flatten the curve. If this is affected by seasons like flu, about which I've read conflicting reports, does that mean we'll experience another wave in the fall? This mutates slowly, so a useful vaccine is more probable, correct? I'll just answer that correct. A useful vaccine is more probable. There are multiple strains of this COVID-19, SARS-CoV-2 virus, multiple strains in different parts of the world. Usually that's a problem when you are trying to make vaccines because they're different strains. That's why we have to create a new flu vaccine every year, depending on what's going on the other side of the world, and we on this side of the world make our vaccines according to what is going on there, and we hope for the best. Last year it wasn't good, this year it's better. So I'll talk about vaccines next week. Also, many museums have virtual tour capability, so it's a neat way to travel outside your house without leaving. Thank you very much, Laura. Museums. The Metropolitan Opera is giving operas. They're giving old operas, recordings, but they're giving operas. So if you go to the Metropolitan Opera, the Symphony, the San Francisco Symphony, your symphony that you go to, oftentimes they have virtual recordings that they're giving you so you can pretend you're going to the symphony, pretend you're going to the opera in your house, pretend you're going to the Louvre, of all things. You can go to the Louvre in France, sitting in your house. Try not to see the Mona Lisa because there are too many people still looking at her. But it's a way that you can distract yourself in a wonderful way and stay home. The advantage you have right now is having time on your hands. Who's ever had that? Who among us have ever had time on our hands? Nobody. Nobody. Now we have time on our hands. We can do whatever we want. We can plan our day however we want. We can be outside and we can be inside. We go to the opera. We go to the symphony, probably some plays too. Art, anyway. Thank you, Laura. This is my cousin, Beth Lindquist. She is wonderful on Facebook. She's always posting everything and she's a wonderful communicator. And Beth is here. Will the Facebook feed be private and limited to the group today? I'm assuming the Facebook recording will not include our faces.
The Facebook recording is a separate recording altogether, so it will not include anybody's faces.
Brandon, hi Beth. The Facebook recording is separate, will not include anybody's faces. I can see certain faces right now. I've seen you all the time you've been here. It's so wonderful. I feel so happy to see you. But it will not include faces, and we will make this open. This will not be private. It will not be just going to the people on the call. Any other things we should answer right? Oh, it's 5 after. One more question.
I've got questions on Facebook if you want them. It's up to you.
Oh, okay.
You want me to field them to you?
Yeah.
Okay.
We'll answer a couple Facebook questions, and then we'll have to go. It's 5 after 3.
I'm going to pick out the ones. Somebody asked if vitamin C and elderberry supplements were helpful for COVID.
The question is vitamin C and elderberry supplements helpful for COVID? Now, the man who first discovered the health benefits of vitamin C is a laureate. He was at Stanford when I was at Stanford. He was a next door neighbor. I go to a person now who's a physician, who's an anesthesiologist. He believes that vitamin C is helpful. The controlled studies that are doing, where you have a control group and you have someone taking the vitamin C and you see the effects in the control group and you compare them to the health benefits that seem to be happening in the people taking vitamin C. There have been a lot of studies about that. And there are none that have really proven the effectiveness of vitamin C. This man always takes a big dose of vitamin C whenever he starts to get sick. And he's a physician. He's smart. Not all physicians are smart, but he happens to be smart. So it won't hurt you to take vitamin C, and it might help you to take vitamin C. It might help you to take the antioxidants. They're in elderberries. It will help you. I'm growing blueberry bushes. And I'm going to give these blueberry bushes to Erica and to my sister Kathy and my mother. The blueberry bushes to help with antioxidants. It might help. So it will, as long as it doesn't hurt you. How vitamin C hurts you is it collects and forms crystals in your urine of vitamin C. If you take enough of it, you have to take a whole lot of it. But if it does that, that's not helping you. Okay, what else?
I have a question here there's 2 more questions for you, okay? So the first one is, somebody asked, I'm a liver cancer survivor. What medications should I stay away from if I start having symptoms of coronavirus or due to coronavirus?
So this person is a liver cancer survivor, which is a miracle all by itself. Anybody who survives liver cancer, you have to have your higher power helping you out on that for sure. A lot of us, including me, are cancer survivors. A lot of us also have diseases like multiple sclerosis, which makes us more susceptible. Liver cancer survivors, they're more susceptible. What should I do to take when I get COVID, when I get the SARS-2 virus.
What, is there anything they should stay away from?
Should you stay away?
Any medication to stay away from?
Here's the thing. There is no treatment for this. There is no known treatment. If your doctor and you're a liver cancer survivor says that you can take Tylenol, which is bad for your liver. In general, Tylenol is bad for your liver. So I would avoid that unless your doctor says you can take it. So Advil is most likely not a problem in the doses that you see on the bottle that are in moderation. So if you're not sure, you have to ask your doctor, but in general, since there's no treatment, the treatment is mainly for the symptoms, to help relieve the symptoms. And you can take the, okay, next one. Last question.
The last question is, since my eyes are closed when I'm meditating, do I set a timer so I know when to finish?
Oh, this is a good question about meditation. When you meditate, Paul, I know Paul's been, the doctor, has been meditating for years and years, probably as long as I have, except he's not as old as I am, so hasn't been meditating for quite as long. But when you meditate regularly, you will somehow know when the time is up. It's intuitive. It becomes intuitive when you do this regularly. It's amazing when you first start to do this and you say you're going to do it for 5 minutes or 10 minutes, or say you're going to do it for the whole time. You can't do that right away, but by the end of the week, you can probably do it for the whole time. It's amazing that when you open your eyes, hopefully there's no clock right nearby, but when you do look at a clock, it's 20 minutes. So I don't want you to set a clock and have an alarm go off. That's not really the way you want to finish your meditation. I would just say meditate for as long as it's comfortable for you, and then come out of the meditation by taking the same deep breaths. Then ask your higher power for help and pray. Pray is the last thing you're going to be doing. Pray. Ask for help. When you're finished, and first, express your gratitude. You know how when they teach you how to pray, you always say thank you first? Express your gratitude. This was a good one. I'll be finished soon. But when Deepak Chopra was talking this week, he gave an example of another friend of his who used this as an example for gratitude. He said, suppose you're somebody who has a toothache. It really hurts you. It hurts a lot. You can't think about anything but this tooth. You try to relax, you try to meditate, but the tooth keeps on hurting. You try to take Tylenol, you try to take Advil, the tooth keeps on hurting. And then somebody pulls the tooth and the pain miraculously goes away. And you say, thank you, I'm so grateful, thank you. The toothache is gone. But yet, why don't we say thank you every day that our teeth don't hurt? So think about all the things you can be thankful for. Look at all these pictures of people that aren't you and say thank you for what you have and try to give them help in your mind's eye. Thank you, gratitude. And then you ask for help for yourself. Then you're finished. But you'll be back again another time the same day. I think that's about it, all we have time for questions for today. But thank you all for coming. I really appreciate it. I'm trying really hard to use everything I've learned over all these years to help replace fear and panic with knowledge, to help educate you about this, to help you turn into people who think in positive thoughts, who think scientific facts, and who then act on those. And so I'll see you next week. Remember, we're a brigade now. We have formed a brigade in this army.